Okay, I believe Aya or Ishwa, you guys are also recording. I'll record too myself.
Yeah.
Okay, awesome. So let's get started. First of all, a little overview on the subject. So we'll start with what the purpose of it is, what the purpose of a root canal is, and just a general what is it, and then who performs it, who exactly performs it. Is it just general dentists, other specialists? And then we'll talk about the anatomy of the tooth, explaining the parts that are damaged, and specifically the pulp in this case. And we'll also be comparing the anatomy of a normal tooth versus the anatomy of an abscessed or damaged tooth in need of a root canal. So you guys will be putting those side by side, and you can get a clear idea of what the difference would be. And then why you might need a root canal, the benefits of root canal treatment, the specific steps of the procedure, and then getting a little bit more in detail. I'm just going to admit this next person, getting a little bit more in detail into the instruments used, and then care following the treatment, some treatment alternatives. Let's say if you've done a root canal, but now you need a retreatment, or a root canal would no longer work. What are some other treatment options? So we'll be talking a little bit about those alternative treatments as well. And then we'll end off with a little FAQ section where we'll be discussing some of the common questions asked when it comes to root canals, and maybe we'll get at some of the major myths that have to do with root canals. So hopefully things will get clarified for some, or if not a lot of people here. And we'll just end off the presentation with some time to discuss a few questions and have a little discussion. If you guys want to discuss anything about the presentation, about the topic, we would love to do that at the end. So yeah, so let's get started.
Okay, so starting off with the purpose of root canal therapy, it's also referred to as endodontic therapy, so we may interchange between endodontic or root canal therapy throughout the talk. And essentially, it's a process of removing infected, injured, or dead pulp from inside the crown and roots of the tooth. The main purpose is to save the tooth, which will ultimately help prevent other teeth from drifting out of line, and it can also help preserve the bite and smile, as well as prevent having to replace a tooth with an artificial one, which can often be a very expensive and extensive procedure. So overall, its main purpose is to save the integrity of the tooth. In terms of who performs root canals, it can either be the general dentist or an endodontic specialist, also known as an endodontist. So for general dentists, they have the general training to perform endodontic treatment, but really whether or not they're going to perform a root canal on a patient depends on whether they feel confident and comfortable enough in doing the treatment for the patient. On the other hand, endodontic specialists have additional training after dental school on performing root canals and other procedures involving the inside of the tooth. And ultimately, they're specialists in saving teeth, which is why a family or general dentist often refers patients to endodontists to have them deal with performing root canals on patients along with other complex cases. So now that we have an idea on the purpose and who performs root canals, we wanted to go over the anatomy of the tooth. So first, we'll start off with a healthy tooth. We know that if you can look on the image to the left, the two main components of the tooth are the outer part called the crown, and underlying kind of the gum tissue is the root of the tooth. So the crown is made up of an outer enamel and dentin layer that serves to protect the underlying structures and prevent bacteria from entering the tooth. And making up the root is the root canal system that is filled with soft dental pulp made up of nerves, blood, and lymph vessels that supply the tooth. As well, if we can look kind of at that spongy outer layer surrounding the tooth is the bone, and this holds the tooth with the help of tiny periodontal ligaments attached to the roots. And so the final thing I want everyone to focus on in the image to the left is that red area that depicts the pulp chamber, and then deeper down the root canal that contains the pulp tissue. In unhealthy conditions, now, we can see here that there's decay and bacteria can enter the tooth through cracks, cavities, or a loose filling. In this way, pulp can become inflamed and infected as it gets attacked by bacteria. And the root canal can also get involved if bacteria can penetrate deep enough, and this results in sensitivity to cold or hot foods, throbbing, aching, or pain when chewing, as well as swelling. If bacteria can further persist down the root canal, it can also ultimately lead to infection of the bone. And as I mentioned, it can do this through escaping through the root openings. And this leads to the bone breaking down, as well as the periodontal ligaments that may swell, causing loosening of the tooth. And finally, what's depicted here is back to that slide. Depicted is an abscess tooth, and so we can see this red inflamed area called an abscess, which is essentially a pocket of pus that can form in various parts of a tooth as a result of bacterial infection.
Okay, now we'll be talking about what causes a root canal injury. So the bacteria in our tooth and food we eat can create tooth decay, leading to several teeth issues. This can lead to an infection in the sounding tissue, like you just saw in the previous slide I was talking about, the abscess. Fractured tooth can also cause a lot of pain because the pulp and the inside or interior of the teeth is exposed to infections. And if a root canal treatment might be needed to fix that. If you experience a traumatic injury by your teeth, such as blow to a tooth, it injures the sensitive nerve tissues as well. So a root canal treatment might be needed to fix that as well. A cracked tooth or a loose filling in a tooth might be a cause to a root canal injury because your tooth is no longer covered properly. And the little crack sometimes can be enough to start an infection in the tissues. Periodontal is also known as gum disease, is usually due to a buildup of plaque that may have traveled down to the roots and the interior of the tooth. And the infection can extend into the pulp of the tooth and also to the surrounding tissues and other teeth as well. Next slide. So what are some benefits of getting this root canal treatment? Since the treatment eliminates the infection from the pulp, it relieves any excruciating pain that you were in. And also after the procedure, you can basically go back to your normal routine, meaning you can effectively and efficiently chew now that your tooth is restored. You can bite into the food and apply force, basically just like you were doing before you were having any kind of problem. So you can bite into the food and can apply force basically. And also protects the other teeth from getting an infection. If you have like if you left that one tooth that was in pain untreated, it can cause infection to the other teeth and cause more painful experience and procedure that you might have to go through after that. So after this treatment, the natural appearance stays the same. Your teeth appears natural just as before. The procedure does not have anything to do with the appearance, and it does not change it. Lastly, like I said before, if you get it treated on time, you save the other tooth, and then if there's only one tooth, then it might be cheaper, and then if otherwise it gets pretty expensive later on if there's more problems to the other teeth as well.
Okay, now on to the specific procedure of root canals. So the first step is that either the dentist or the endodontist would apply the local anesthesia or freeze the area, freeze the tooth. And so the procedure would be more comfortable for the patient. The next step is to protect the tooth from saliva bacteria or blood or just any like kind of anything extra in that area to prevent it from going into the exposed tooth and the exposed pulp and getting that in touch with even more bacteria when it's already infected. A rubber dam is placed around the specific tooth in order to isolate it. In a couple of slides, we'll be looking at a video that actually shows more visuals and it actually shows that rubber dam. And it also is a very good review of the procedure. So that will give you a better idea of what we're talking about here. So look forward to that. And as part of the third step, an opening is made to access the tooth pulp. As part of the fourth step, we remove the pulp from the root canal and the pulp chambers using tiny flexible files. And basically the files, they help remove the pulp and clean the area. And they also help enlarge the canals. And as we talk about in the next step, shape the canals before they get filled. But yeah, so they enlarge the canals and they're cleaning them. And also they're used in combination with an irrigation solution. And they're used in a repetitive manner. So it's like the dentist uses the files, it gets followed up with irrigation process, the flushing of the tooth, and this happens back and forth until the dentist deems it necessary. And then the next step or the fifth step is shaping the space of the root canals before they get filled. And then the canals get filled with a rubber-like material called gutta percha, and that gets sealed with an adhesive cement. And basically now the canals are cleaned, they're filled, and the last step, or the seventh step in this case, is that a temporary or a permanent filling is used to seal the tooth, to close it off. And a crown can also be sometimes used for added support for the tooth, especially when we're talking about molars and premolars, because they would be under more pressure and force when it comes to chewing and biting down on things. So a crown would be needed. And again, that's at the expression of the dentist or the endodontist that is doing the procedure. And then again, just a couple of important points to kind of keep in mind. The choice of restoration used will depend on the strength of the tooth left and how much force will be placed on it. And if not enough of the natural tooth is left, metal posts are used to support the crown. As you can see in these two pictures, you'll see the metal posts that are used and the crown is here. So again, when not a lot of that tooth structure is left, we need that metal to kind of be inserted and provide more structure and support. And yeah, so we talked about how we were using files, and we also talked about irrigation, which we'll discuss more in the next slide. The using of the files is a part of that mechanical cleaning process of the root canals. We have two main types of files that are used. The first one is the stainless steel hand files. They're sometimes also made up of nickel titanium. The good thing about nickel titanium files are that it's more flexible, which we know is very important for this type of a procedure. With these hand files, they're at 0.2 taper, and essentially what that measure means is that the file gets 0.2 millimeters thicker for each 1 millimeter that you go up from the tip of the file. So if you look at like an example file as you see in this picture over here, if we're dealing with this hand file or the 0.2 taper, as you go, for every 1 millimeter that you go up, the diameter of the file gets thicker by 0.2 millimeters. So that's again what the taper means. And with these hand files, we have the K file and we have the H file. The K file is the cur, also known as the cur, and the H file is known as the headstrom. The K file has the twisted square shape to it, and it's used, the dentist or the endodontist uses it with a watch winding method. So if you look at how the dentist would use a specific type of file, they kind of use it as they're going into the canal, they kind of use a back and forth method they might turn the file clockwise, counterclockwise, and this is kind of like compared to the winding of the watch. So this is the procedure that is often used with these K files. And then with the H file, the shape of them is that a spiral cone shape. And it's important, what's the specific point that is important to remember about these H files is that they only cut in retraction. So they only do the shaping of the root canal as they're pulled out of the root canal. And then the second type that we wanted to talk about here was the nickel titanium rotary files. These files, again, they're files, of course. They're made up of nickel titanium, but they're rotary files. So instead, where the finger handle is, the latch attaches to a rotary handpiece, which of course is going to be rotating at a specific predetermined RPM. And again, a characteristic feature of these rotary files is the 0.4 to 0.6 taper instead of the 0.2 taper as we learned with talked about with the stainless steel hand files. And again, what the 0.4 to 0.6 means is that for every 1 millimeter that we kind of go up from the tip of the file, the diameter of the file gets larger by 0.4 to 0.6 millimeters. And again, whenever you see these files, you kind of notice there are different colors and the different numbers on them. And I also kind of like have a little picture of the different colors and the different numbers here at the bottom as well. And something to note about the number, the bigger the number is, the wider the diameter of the file. And for example, if you have, in this case, this white file, the size 15, what that means is that at the tip of the file, the size of it is 0.15 millimeters. Or if you look at the yellow one next to it, the size 20, the tip of the file would be 0.2 millimeters. So that's how it would work. And then again, the next step would be the chemical aspect of cleaning the root canals, in this case called irrigation. And yeah, so it's important to irrigate or flush the canal after every file that is used. And we talked about it when we were specifically discussing the procedure of a root canal, how there's that repetition. The file is used by the dentist and then the tooth is irrigated, it's flushed and cleaned. So that's kind of like overall, that's the total cleaning process. And as part of the irrigation solution, a key chemical seen in that is sodium hypochlorite. And that's essentially bleach, but of course it's going to be very diluted, specific for this type of a procedure. And it's an irrigant, and specifically it dissolves organic materials such as bacteria. And again, we know that this main point of a root canal procedure is to get rid of that infection, to kill that bacteria and get rid of it. So it makes sense that we need something like this. And another important chemical used is ethylene diamine tetraacetic acid, or EDTA for short. It's a lubricant, part of the irrigation solution again. And this one dissolves in organic material, such as shaved off dentin, as the files are used to kind of clean out the pulp. Some dentin gets shaved off, and this is what dissolves it. And again, in a few slides ago, I talked about how we have a video, and this is here. I just wanted to, it'll be a good review for everyone of the procedure of a root canal, and it'll also give some visuals. So hopefully everything that we talked about will make more sense. So let's just quickly watch this together.
So we can hear it.
Oh, sorry, can you guys hear it?
No.
No? Okay, let me, I think it's
Try removing your headset.
yeah, let me. Okay, let me try again.
Your smile can last a lifetime.
No.
Is it good now?
Yeah, it's fine now.
Awesome, okay. I'm gonna start from the beginning then.
Nothing looks, feels, or functions like your natural teeth. And with the right care, your smile can last a lifetime. But problems like decay, disease, or injury can threaten teeth and ruin smiles. Thanks to advances in treatment and technology, many teeth can be saved. One way a tooth can be saved is with a procedure called root canal treatment, also known as endodontic treatment. Endodontics is a specialized area of dentistry focused on treating disease or injury to the dental pulp. Endodontists are dental specialists with advanced training in root canal treatment. They are experts in saving your natural teeth using state-of-the-art technologies like microscopes and digital imaging to treat you quickly and comfortably. Let's take a step-by-step look at a modern root canal procedure. Here is a healthy tooth. Inside the tooth, under the white enamel, is a hard tissue called dentin. Inside the dentin is a soft tissue called pulp. The pulp contains the tooth's nerves and blood vessels. It extends from the crown of the tooth into the roots of your teeth. If the pulp becomes inflamed or infected, your endodontist will remove it, relieving your pain or discomfort. Here's how root canal treatment works. First, your endodontist will numb the tooth so that you won't feel anything during the procedure. A small shield isolates the tooth, keeping it dry and clean. An opening is made through the crown of the tooth and into the pulp chamber. Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist fills and seals the root canals. In most cases, a temporary filling is placed to close the opening until you see your dentist. After your endodontist is finished, you must return to your dentist to have your tooth properly restored with a filling or crown. That protects the tooth and is important to ensure the success of your root canal treatment. A tooth that has had root canal treatment often lasts a lifetime, so you keep smiling with confidence.
Okay, awesome. Hope you guys got good information out of that, and it kind of just clarified some maybe other questions that you had, and now you have a better idea of what the procedure is like. So yeah, and on to the next slide. Oh, no, we don't want that. Okay. I'm sorry. Can you guys still see the full screen, or
No, it's not full screen anymore.
it's not full screen anymore?
No.
Oh, that's weird. Um, okay, I think like you can clearly see the screen, right?
Yeah, we can see it.
Okay, it's okay. But yeah, okay. So the next step was to discuss the care following the treatment. So now the procedure was done, the root canal was done, and what now? So like, what are the possible things that can happen now, and how do we deal with that? One possibility is discoloration of the specific tooth. Again, this is not a medical concern. It's nothing the patient, or if you have a root canal, you should be worried about. It can be fixed with a very simple bleaching and whitening procedure. And yeah, it can be fixed with a simple bleaching and whitening procedure. And an endodontically treated tooth, also known as a non-vital tooth, so that's some important vocab to keep in mind, is often more brittle than a regular tooth, making it more prone to fracture. So again, you want to be more careful with it. And that's why a lot of the time the dentist suggests and decides to put a crown to support the tooth structure. So yeah, that's something important to keep in mind. And yeah, so there's also some possible complications that could take place, and that could result for a need in retreatment of the root canal of the tooth, and a possibility of kind of like the root canal procedure being repeated, or if that's not if the dentist is not able to do that for some reason, maybe some alternatives would be used.
But yeah, some of the possible complications would be the existence of accessory root canals, which are large side canals coming off from the main canal that cannot be properly cleaned out. You can see that clearly in this picture. This is clearly an accessory canal. It would be very hard for the dentist to be able to clean that out with a file or with the irrigation solution. And that, if it's not treated and if it's not cleaned properly, of course, could possibly lead to a case of reinfection, and that means possible need for retreatment. The second reason would be a badly curved and narrow canal that prevents proper cleaning. So that is an example is clearly seen here in this X-ray. And yes, sometimes even like with specific canals, they might be narrow and they might also be just closed off. So again, they can't be cleaned, and a little bit down the line, it might cause reinfection and kind of like the whole problem. There will be a whole problem all over again. So there's also chances of that. And the third problem, again, tissues fail to heal and the tooth becomes painful. That's a possibility. And yeah, so it could become painful. It could become diseased months or even years later after the procedure has taken place. And that's a possibility. And that's something the dentist always should be discussing with the patient, especially those who are more at risk of this type of a situation happening for them, so they're aware. And again, the fourth reason is possibly new trauma happening to the tooth, putting like the tooth being at risk for this retreatment again. And then if there's deep decay, again, kind of like the tooth is exposed to. And again, if there's another loose, cracked or broken filling that is not taken care of properly and on time, then it's going to cause for retreatment of the tooth with another root canal procedure.
Okay, so now, as Yasmin introduced in the beginning, we want to touch a little bit on the alternatives to root canal treatment. And so here we're focusing on three main alternatives. First is the endodontic surgery. So as Yasmin mentioned, some complications to the treatment is missing those hard to detect accessory canals. And one benefit to using an alternative such as endodontic surgery is to help identify those hard to detect canals. It can also be used to remove calcium deposits in the root canal and can treat damaged root surfaces or the surrounding bone of the tooth. For example, an apicoectomy can be used, which is typically used when infection persists, possibly after a root canal is already done, near the bony area at the end of the tooth. Another alternative is dental implants, and this is usually done when the natural tooth can no longer be saved and it needs to be extracted or removed and replaced with a dental implant, which is shown in the second image on the right, where we see that screw. That's an example of a dental implant. The point of this is to allow for proper chewing and eating, proper speech to ensure that no teeth get shifted, and overall to maintain the natural appearance of the teeth. Lastly, pulp capping, usually with a Vitrabond pulp cap, can be used as an alternative to root canal treatment. So sometimes when cavities reach the nerve, this pulp cap can be used over the exposed nerve to prevent it from being exposed during a cavity preparation. It is a cheaper alternative when appropriate for patients needing a root canal.
Okay, and now we're almost done with our presentation. Last thing we need to talk about are the frequently asked questions. So the first one usually is, does the root canal hurt? No, it does not. Since patients are given anesthesia, root canals don't really hurt more than any regular dental procedure that you might go in for, such as getting a filling. And root canals can be a bit sore and sensitive after the procedure, just like all the other procedures. And it can cause mild discomfort and some swelling, for just a few days. It should not be for a long time, just a few days after your procedure. And oftentimes, some over-counter medications can help, such as Adderall and Tylenol. But if you need anything other than that, the dentist might prescribe you with other medications as well. The next question that is frequently asked is, how do I know if I need a root canal? So these are some of the signs that you can look for if you think that you might need one. One of them is lingering sensitivity to anything cold, any pain while chewing or biting food, pimples on the gum, chipped or cracked tooth, any swollen or tender gums, and any color changing or darkening of the gums as well. This should be a good sign, or these should be the signs that you should look for if you think that you might need a root canal procedure. Next. Okay, so third frequently asked question is, how much does it cost? Is it expensive or cheap? So honestly, it depends on how complex your case is, which could be different for everyone, because it depends on which tooth is affected. For example, if your molars might be the ones that are affected, could be harder because it's harder to get to, and then could be more expensive as well. And it also depends on if you need any specialist consult. So if you do, then it might be more expensive than the others. Also, most of dental insurances cover a root canal procedure. It would depend on the kind of coverage you have. This root canal procedure is a much cheaper alternative than just getting your tooth extracted and replacing it with a dental implant, which basically also restores chewing function and prevent any teeth from shifting. Fourth one is, can all teeth be repaired through endodontic treatments? No, not if the root canals are not accessible. For example, 216 and 26 have 4 canals, and sometimes a fourth can't be found for it to be cleaned. Therefore, there's still a chance for getting a reinfection after the root canal. I think Yasaman also talked about in her slides that there is a one that comes out of the side of the teeth that you can really get to and clean properly. And you can also do that if the root is really damaged. Not if the tooth doesn't have adequate bone support, so you can have an endodontic treatment for that as well. However, there's been advances in endodontics that have made possible to save teeth that couldn't be saved like a few years ago, but it's now possible to get a procedure done on those teeth as well. Okay. So the fifth one is, what if you delay or don't get your endodontic treatment? Like we said throughout our presentation, that the infection in the tooth can spread to other parts of the teeth as well. Other teeth can be affected, and it could possibly become life-threatening as well. And eventually, if the bone loss can also lead to the tooth loss, because if the underneath the upper part is not functioning properly, so you can't be chewing stuff, and then you won't be having any regular functions done, so it would be hard. And the last one is, how can root canals be prevented? So there's some instructions that we have written here. So you can follow proper oral hygiene, go for regular cleanings and dental exams, and fix any cavities that you have before they progress. So if you have one, don't wait for a little bit to go and get it done. Just go see your dentist right away, because you don't want to wait and then have to spend a lot more money than just getting one done. Stay safe from any traumatic blows to the mouth, and also fix cracked or loose fillings as soon as they're detected. Like, again, if you don't get one fix, it's gonna get worse from here. So you might want to go ahead and fix that right away. I think that's it.
Yeah, so thank you everyone for tuning in and following along with us. We were We had a lot of fun researching and learned a lot preparing this presentation for you. And now we'd like to open up the floor